Good afternoon, everyone. Thank you for joining PHCA today for this webinar, an update on emergency preparedness and the Life Safety Code presented by Charlie Schlegel, Director of the Division of Safety Inspection for the Pennsylvania Department of Health. My name is Abby Foster. I'm the Director of Marketing and Member Services for the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members for NAB-approved credits in order to receive updates from the department staff on regulation, learn from industry experts on current trends and practices, and gain a better understanding of practical application tools to equip our members so they can continue to provide the highest level of quality care possible. Today's webinar will give the audience an overview of many of the recent changes to the Life Safety Code requirements used for state licensure and federal certification that were new to the survey process starting November 1st, last month. The information is pertinent to compliance for existing healthcare facilities as well as new construction and renovation projects. In addition, the webinar will focus on review of the new CMS emergency preparedness requirements specific to long-term care facilities. Today's learning objectives are to understand the adoption of the 2012 Life Safety Code, how it applies to your long-term care facility, review of major LSC changes that apply to existing healthcare facilities and new construction and renovations, and to provide an overview of the new CMS emergency preparedness requirements for long-term care facilities. A few housekeeping items. This webinar will be recorded and made available on the PHCA website following. The webinar has been approved for 1 continuing education credit for skilled nursing home administrators, and unless specified, PHCA webinars are a members-only benefit. Non-members are welcome to participate to gain a better understanding of this membership benefit in the topic, but will not receive this continuing education credit for their participation. Certificates will be emailed following the conclusion of the presentation. All attendees will be in listen-only mode, but throughout the presentation, if you have any questions, please feel free to submit them via the questions pane on the right-hand side of your screen. We'll address the questions at the end of the presentation. At this time, I'll turn the floor over to Charlie Schlegel. Thank you for your participation.
Thank you, Abby, and I appreciate the opportunity to speak to everyone, and I appreciate everybody taking time out of their schedules because I know it's a very busy time of year to listen about the Life Safety Code. But we have a lot of things to go over, and then we'll try to make time at the end so you have a chance to ask some questions. And if we don't get to all the questions, Abby and I talked in reference to getting them submitted, and then we'll still get a chance to answer those after the presentation. So for the overview, we want to talk a little bit about the adoption of the 2012 Life Safety Code by CMS, which also includes the 2012 Healthcare Facilities Code, so we'll explain what that is. Some of the differences between the 2000 code, which we used before, previously, to the 2012 Life Safety Code, which is new. Some of the major changes to some of the reference codes. A little bit about building rehab. We'll spend some time on the CMS Emergency Preparedness Rule. And then I have a number of slides in here about House Bill 264, which is the carbon monoxide law, which affects long-term care facilities. So as everybody knows, the CMS adopted the 2012 Life Safety Code and Healthcare Facilities Code with an effective date of July 5th, 2016. And this is replacing the 2000 edition, which we've been using since 9/11/2003. So it's been quite a few years since we've updated codes. So there's a lot of new information out there for everyone. To be consistent for state licensure, we also adopted the same 2012 Life Safety Code to follow the CMS. That way, when we're doing your survey, we're doing the survey for both state and federal purposes, and we're using the same requirements. So the importance of the July 5th date, it determines when the building component is surveyed as new or existing. So those with the plan approval date on or before the effective date are considered existing, and those with the plan approval date after the effective date are considered new. So Life Safety Code is a little bit different in that the requirements have, you have 2 different chapters. One is for existing healthcare facilities, one is for new. So the July 5th date determines whether you're looking at Chapter 18 for new or Chapter 19 for existing. And there's some information we'll talk about in the building rehab and what that means to folks that came in under and were built under 2000 new, and now they're going to be 2012 existing, what that means for them. But the big importance of the July 5th date is what code, what chapter of the code we're going to use, either Chapter 18 or 19 for your long-term care building. So different than the effective date, is the implementation date. So as Abby was talking, we started surveying on November 1, 2016, and that's when we're using the 2012 Life Safety Code. So that is the implementation date, that's the November 1 date, and that is the difference between July 5th, which tells us what chapter to use, to November 1, which was the guidance from CMS saying this is the date that you start surveying for the new requirements. And in that in-between time between July 5th and November 1, we were still using the 2000 code requirements. So a lot of people are very familiar with the Life Safety Code, and NFPA 101 is interchangeable with the Life Safety Code, but they don't understand what the Healthcare Facilities Code is, and there's a lot of concern of what that means to the nursing home and what are the new requirements. But Healthcare Facilities Code, while it was adopted by CMS a little bit differently than they did before, is NFPA 99, which has always been enforced through mandatory reference through the Life Safety Code. So if anybody's been cited for oxygen storage, or we have some generator requirements, emergency preparedness, that was all through NFPA 99. So it's nothing new that you have to, it's not a new book you have to comply with or new requirements, other than the fact that they're updated from the 1999 edition to the 2012. But it gives CMS some extra options in giving waivers to that edition if they ever have to in the future. A little background, we'll spend a little bit of time. Life Safety Code is very easy. It's minimum requirements to do regard to function, to design, operation, and maintenance of buildings and structures for safety of life from fire and some emergencies. I would suggest that the Healthcare Facilities Code people go back and try to kind of figure out their purpose, because if you read that, it's to provide minimum requirements for the installation, inspection, testing, maintenance, performance, and safe practices for facilities, material, equipment, and appliances, including other hazards associated with the primary hazards. If you read that and you're trying to figure out what the purpose is, I think a lot of people would have questions, because being in the business, if I just by reading that, it's very confusing to me as well. But a way to remember it, it's a very important document for NFPA, but it's going to provide information on medical gas and vacuum systems, that electrical equipment, that gas equipment, the e-cylinder storage and things, and similar health facility-related topics. So what you saw is the purpose. Really, you could kind of substitute this information for that to kind of understand what the Healthcare Facilities Code is. If anybody has a hard time sleeping at night, I always joke that you can go and read the final rule. So I put that in here for you. It's quite a few hundred pages, just saying that they're adopting the 2012 Life Safety Code and Healthcare Facilities Code. So the first thing that you're going to see, so November 1, we're using the new tags, and for a lot of you folks, you're also getting familiar with the health side, where you're getting the new F tags. We're also getting all new K tags. So at first we looked at this and we said, oh man, I've been with the Department of Health since 2000, so I've always known K18 as corridor doors. How in the world am I going to remember it as K363? Because now that they changed the code, they also changed the tag number that we cite things. So K29 was hazardous areas for all those years, and now it's K321. So first we were a little bit worried about that, and a lot of people that are have been in survey quite a bit in the past. If you understood what a K18 for corridors was, now you have to look at it as K363. But they actually did a pretty good job here of making sense of what the deficiency is. So if you get cited for a K363, you go to Chapter 19 if you're in an existing facility, which most people are now. You go to Section 3.6.3, it actually gives you the requirements for corridor doors. So K363, you open up your Life Safety Code book to Chapter 19.3.6.3, and you can see that's the section that gives you the requirements on corridor doors. Whereas before it was K18, which was just a marker for it. Same thing with hazardous areas. So it used to be K29, now it's K321. So it gives you, as somebody that's working at the facility, if somebody says, okay, we're going to cite you for K321, you can then go and open up the book and find that requirement at section 19.3.2.1. Now, I will warn you, I'm told it doesn't work for every single deficiency. So if you find one, it's not an aha moment. I got CMS. They tried their best to make it work for everybody, but there will be some that they just couldn't make that work for. But for the vast majority of them, you can use that to help you find the section. So the Pioneer Network, Rothschild Foundation, a lot of folks worked really hard to get some of the 2012 code changes to be permitted through the waiver process. So a lot of facilities had waivers, whether they be for kitchen cooking, furniture in quarters, generator maintenance, but they're no longer required. Now we adopted the 2012 Life Safety Code because they were sections that were based on, we're giving you this waiver because it's actually in the 2012 Life Safety Code. So now that we're using the 2012 Life Safety Code, we no longer need those waivers. So I tell everybody you can stop sending in those waiver requests because I would just answer you back saying it's no longer required. So those were things with the long-term care world. It's pretty popular with the patient lift and transport equipment, some of the decorations, and the cooking. It was expanded. The hospitals, their organizations saw that there were some waivers and there were other opportunities for waivers, so that's where you got into some additional requirements, and that really helps for some of the, where they changed some of the requirements for maintenance for emergency generators and the sprinkler systems. So there are a lot of things in the 2012 code that people didn't want to use by waiver because it wasn't as fun and popular. So those are the changes that, some might be advantageous, but others are going to be a little more stringent. And those are some of the ones we're going to go over today, so you know what to look for come your survey time. So this one's a pretty easy one. There was always the question of, I have a non-combustible building. Am I allowed to use any type of fire retardant treated lumber as to support anything, like if I'm putting a computer kiosk or maybe my handrail? So this is saying they did clarify in the 2012 Life Safety Code that you can use FRT, fire retardant treated lumber, for things in a non-combustible building and still be considered limited or non-combustible construction. This one's a little bit bigger one. So this is something we started with November 1, 2016. Since it has a one-year time frame on it, you really have 1 year to get everything together. So this first year is a good opportunity to talk to your Life Safety Code surveyors on what fire-rated door assemblies should be inspected by in accordance with NFPA 80. But it's going to be your fire-rated doors that you're going to see that have the labels. They're going to be at the stair towers, 2-hour separations between other occupancies, mechanical spaces, hazardous spaces. So it's, the first thing we're going to have to do is really get an idea of what doors are out there. And you're going to see it's a pretty comprehensive requirement. So it's not so much that we're just checking to make sure the door closes and latches. We're checking the gaps. So you see the young lady there checking the gap of the door. Then we got the gentleman checking the self-closing hardware at the top of the door, and another gentleman down at the bottom checking clearances at the bottom. So you can see there's a lot of things that go into checking these doors. And it applies to new and existing installations. So this applies to everybody. Inspected and tested not less than annually. So that's where I was saying we really have that 1 year to get this program up and running, but I would encourage you not to wait till the last second. Get it started now. A written record shall be signed and kept for inspection by the authority having jurisdiction. And this is not just a signed, I checked all the doors and they're fine. And this is one of the few things where you'll find that it says functional testing by knowledgeable individuals, which a lot of people ask me what that is. So, what we've instructed our staff to do is very similar to what we would do for your fire policy or fire training. To figure out if somebody's knowledgeable, we're going to interview them. Okay, Charlie, how did you're the one to check these doors. How did you check that coordinator on top of the door? If I don't know what a coordinator is, then, maybe there's some questions about if I'm the one that should be checking those doors. But if I can say, yes, this is how I did it, then I'm knowledgeable on how to make those checks. There are some tests out there, or some trainings and certifications out there, but they're not, a bunch of them out at this time. So that helps as well. If you want to send whoever's doing the testing to go get certified, then you can say, I'm knowledgeable because I have the certification. That is, a feather in the cap and really helps out. Repairs should be made without delay. I always joke that if anybody's ever ordered a door, with holiday season, when I come home at the end of the day, there's usually 3 or 4 boxes that say Amazon at my front door. That's not how it works with doors, especially fire-rated doors. You just don't go to Amazon, click it, and the drone drops it off on your front porch. it's one of those things that sometimes it takes a long time. So repairs made without delay. We're really looking for some type of record showing that maybe I don't have the new door without delay, but I have it ordered. We're getting the money for it. We did these repairs in the meantime while we're waiting for the other door. So there are other things that we could do to show that we're making those repairs without delay. Some of the things we'll quick go over. We're not going to go over all of them, but you'll see that when we're talking about comprehensive, it's you got your clearances, parts, any hardware is operating properly, and some of these things might not apply. If you don't have vision panels, then obviously we can't be checking for them. The one big thing is no field modifications would void the label. So the label is extremely important for a fire-rated door. So obviously we can't install it on the bottom of the door. We can't see it. But also full-length hinges. Sometimes they will cover the label of the door, or somebody will paint the label. And the other thing is we can't just, you're not allowed to just have anyone take the label off of a door and put it somewhere else on the door. That actually voids the label as well. You have to have somebody come out that's either from the door manufacturer or somebody that's able to do that for you. So we can't just move the door labels, and we need to make sure we don't paint them or make them so that we can't read them. Similar requirements for sliding and rolling doors, and that's where we say prepare now. Don't wait to next year to get cited and try to get the program in place. Now is the time, and when you have somebody coming out from life safety, ask them, I have a question on this door. Should I add this door to my program? Here's how my program looks. What do you think? And get that ironed out now. Hazardous area clarification. This is a good one. In the past, it was pretty vague. It just said anything that was soil, linen, or trash collection had to be 1 hour fire rated. So the 2012 made a clarification that if the volume exceeding 64 gallons must be 1 hour fire rated. So if you have some smaller rooms that are soil, linen, or trash collection that are less than 64 gallons, and that's capacity, that's not just what you have at any given time, you might not need to have a 1 hour fire rated room, which then means you might not need to have that fire rated door, which could affect your door hardware or your door program. There was a lot of confusion on Firewatch, especially with the proposed rule. CMS wanted to keep 4 hours and 4 hours. So right now, in the 2000 code, it was if your fire alarm or your sprinkler system goes out of service for 4 hours or more in a 24-hour period, you had to do a Firewatch or evacuation. NFPA actually changed that. So the fire alarm system for NFPA still has 4 more hours in a 24-hour period. But the sprinkler system, NFPA 25, went to 10 hours in a 24-hour period because it was taking longer for some of the larger systems to get all their maintenance done. So what happens is, by NFPA standards, you had 4 hours for the fire alarm, 10 hours for NFPA 25, and CMS wanted to make that 4 and 4, but then in their final rule, they did say that it's 4 and 10. So the fire alarm system is out of service for 4 hours in a 24-hour period or more, and the sprinkler system is out of service for 10 or more hours in a 24-hour period, which could be for maintenance or system failure. If we hit any of those benchmarks, then we have to do the Firewatch or evacuation. I would caution people, if you have policies already in place that say 4 hours and 4 hours, we're going to hold you to your policy. But if you want to change your policies, you can to meet the new requirements, where it's 4 hours for fire alarm system and 10 for sprinkler. But just make sure that, one, our policies are set and are code compliant, and then we're actually following what our policies are. So even if the code requirement is 4 and 10, if your policies say I'm going to do 4 and 4, you need to make sure you're doing the 4 and 4. A quick change where at first I didn't think it was that big of a change until I started talking to people about it, especially in rural areas. But they added one component to the fire safety plan, which is something we need to add to our fire safety plan right away before your surveys, is the emergency phone calls to the fire department. So some folks already have this in their plan, but it's new to the 2012 Life Safety Code, and it's new for existing and new facilities. So it applies to new and existing facilities. So what this is it's an emergency phone call to the fire department. I grew up in a very rural area of Pennsylvania. I called the volunteer fire department. There's nobody there. So then a lot of folks were asking me, who do I call? So there are options of maybe calling 911, or there might be some other options out there for your particular facility. And I would recommend talking to your field office just to make sure both parties are on the same page in reference to who we're calling, just to make sure that there's some type of backup in there in case for some odd reason your third-party monitoring is not making that connection to the fire department. So you hear the alarm, you're thinking to yourself, okay, my monitoring agency is on it, then the fire department's going to show up. They want some type of phone call to make sure that that's happening. So we need to make sure that we revise our facility plans appropriately and also train the staff. A lot of people are asking me, okay, I'm doing my fire drill, do I have to make this call? You could simulate the conditions during the fire drill so that we don't have to actually make the call, but somebody could be standing in the corridor and it could be their job to be making that call, and they could pretend they're lifting their phone to their ear and say, I am now calling the emergency, or the fire department are now calling 911. According to your plan. You don't actually have to make the call. This one I left in here for anybody. Most people should be fully sprinkled within their whole building, but if anybody used the CMS mandate to only sprinkle the long-term care section of their building, maybe they're in a 20-story building, only the bottom 4 floors are long-term care, so they sprinkle the bottom 4 floors. Just be careful that they change the mattress and upholstered furniture requirements to say fully sprinkled building in lieu of room. So before it said if you're in a fully sprinkled room, you can just put whatever mattress or upholstered furniture you want. But now it says fully sprinkled building. So if you don't have a fully sprinkled building, there are additional tests that you have to meet, and I put those slides in here. But those are for folks that aren't sprinkled in your entire building. And so most folks should be sprinkled. Stairway identification. So new stairs serving 3 or more stories, but the more important one for everybody on the call is existing stairs serving 5 or more stories must comply. So we get into that existing requirement again. So we need to look at our stair signs to make sure that they meet the 2012 requirements. And what I did again is put it in red. You'll see the first one says eliminate under normal and emergency power. So that's the first one is changed. It doesn't mean it has to be continuously lit like some of your exit signs, but we just need to make sure that we have the proper lighting in the stair tower to have the illumination on the sign under normal and emergency power. Another one I got added was floor level designation. Floor 4 or ground floor has to be tactile. So we need to make sure that we have tactile. If your entire sign meets all the other requirements, but you don't have the tactile designation, there's the option of maybe just getting a sign just for that and putting it at the bottom of your sign instead of getting a whole new sign. That's up to the facility. The next one you'll see, stairway identification must be at the top of the sign in 1-inch lettering, so they're a lot more specific on where it is and what the size of the lettering is. Something that some folks might not have is any stair without roof access has to have the signage on each floor saying no roof access and 1-inch lettering. Floor level must be located in the middle of the sign in 5-inch lettering, and then the lower and upper terminus, so whether it be basement and 4th floor, 1st through 5th, must be located at the bottom in 1-inch lettering. So these are existing 5-story stairs. So if you have a basement through 4 stories, that could be a 5-story stair, or it could be 1st through 5th. So you could have those 5 stories anywhere where it goes 5 different floors. So this again is something we'll be looking at starting November 1st. So we already started looking at it. And I had a lot of questions about elevator signage, but we don't view elevators as a proper egress in nursing homes, so it's not an option for our healthcare occupancies. A little bit real quick on an NFPA 241. This was in the 2000 code, and it's also in the 2012, which is a little bit thicker. So this is the safeguarding the means of egress during construction. So if you're doing construction now, this is a good section to have. If you're planning construction, so the slides are in here. But what they changed is that where you have an area that's under construction and you don't have it sprinklered, so maybe you have the sprinkler system down while you're doing the construction, maybe you're renovating the wing of your building, that has to be a 1-hour fire-rated barrier with 45-minute openings, where that requirement wasn't in the 2000 code. So that's where we need to make sure that if we're doing construction, it's not just painting a room or something. This is where we're doing some actual modifications. That part of that project, we're having that correct separation, Now, if you keep the sprinklers active on both sides, then you don't need the rating, but we do need to have some type of wall system to separate the construction area from the living space of where we're not doing the construction. We still have the residence. So that's now in the code and NFPA 241, important for anybody that's doing renovations. And here you see some of the bottom right is kind of the old wall with the zipper down the middle. Somebody made a ton of money off inventing that zipper in the middle of the plastic, but now you're going to see more of the hard walls like you see on the top left. We'll go over a little bit of NFPA 10, which is fire extinguisher maintenance. So the big thing here is we talked before about the door where it said knowledgeable individual. Well, that's what it used to say in NFPA 10, but now all the testing that's done by either the annual testing or maybe some of the 6th year, the hydrostatic testing, they all have to be done by folks that are certified in NFPA 10. So this does not apply to the people performing the monthly inspections. So whoever's doing the monthly quick checks can keep doing those without being certified. They're more than welcome to go get certified. But anybody that's coming in to do your annual inspections on your fire extinguishers or any other requirements that you need to have done, they do have to be certified. So when we're coming in, we're going to ask you not only to see your maintenance, but we're going to say, okay, show me who did your maintenance and let's see their certification. So they need to provide that to you as part of their service. This is a quick clarification for anybody that has satellite cooking that we've always required the extinguishers, but NFPA has made a clarification that those extinguishers have to be Class K at the satellite cooking as well as the main kitchen. So we need to make sure we have those Class K extinguishers with the proper signage at any satellite cooking stations that we might have. I'm going to spend a lot of time on this. Usually it's something kind of neat to show that there's new technology out there, but maybe if somebody's doing some new construction, there's actually technology out there that replaces the monthly quick checks. So you can, there's a lot of requirements to do so. It has to be tied into your fire alarm, a lot of maintenance that you have to do, but you can have something installed at the fire extinguisher itself, and in lieu of the monthly quick check that you have your maintenance folks doing, this will actually do that for you. It notifies the fire alarm panel if the extinguisher is missing or if something's obstructing the fire extinguisher, so that can take place of the monthly check. This is a really big one, so if you have anything where you print out the slides, this is one I'd put a big red star on or X, or just make sure you know this one's out there. So the big change to NFPA 13, which is sprinkler installation, is actually privacy curtains, which you really wouldn't think too much about, but they did a bunch of studies, and they, in the past, you had to have at least 18 inches of mesh extending down from the ceiling, where the mesh was 70% or greater, but now that got changed to 22 inches down from the ceiling. So in the new sprinkler code, where you used to have 18 inches of mesh, which we have some pictures of here, coming down from the ceiling, you have the ceiling track, and it's coming down 18 inches. Now that top part where you see the mesh has to be 22 inches. And you know, everybody was kind of worried about, does that mean I have to go replace all my curtains? This is only for newly introduced cubicle curtains in sprinkled areas where it says it shall be installed with NFPA 13. So that I provided a section for you in 19.3.5.11. So if you do new renovations, maybe you have something happen where you decide to change the color scheme, you have curtains that get ripped, torn, you want to put a new one up, we should be replacing them with the 22-inch ones. You know, we talked earlier about you know, a lot of, it's shopping season right now. You want to make sure your procurement people, whoever's buying your cubicle curtains, knows that there's probably going to be a lot of curtains on sale right now that only have 18 inches of mesh. Don't buy them, even though no matter how cheap they are, unless you want to drop them down from the ceiling another 4 inches. But you want to make sure that they're buying anything to replace any curtains you have now with the 22 inches of mesh. So the other option too is if you have curtains that are 18 inches and you're putting them in brand new, where you'd have to put in the 22, you could drop them down 4 inches with chains or something like that, but it's just not as aesthetic looking. It's not as appealing when seeing the chain than the mesh. So People are asking me, is the 18-inch rule now the 22-inch rule? And that's no. That would be too easy, right? So 18 inches still applies to all the other obstructions. So if you go into the activities room and you see all the storage all the way up to the ceiling, that's still 18 inches down from the sprinkler. And now 22 inches only applies to the mesh for the privacy curtain down from the ceiling. Everything else is 18 inches. One that we got added to sprinkler maintenance, you want to make sure that it's in your, and you'll see it's a 5-year program, so we're not looking for it right now. We're just warning you that in 5 years, you need to make sure you have this done. I wouldn't wait 4.5 years because the sprinkler companies know it too, so they'll probably charge you more. So you want to get this done kind of timely. But there's a new flushing requirement for your sprinkler system, because if anybody's looked inside that pipe, it can get pretty bad looking in there. So we're looking at the inspection of the inside condition of the pipe. And that does, I think I have it on the next slide here, it is for dry pipe and pre-action systems as well, so it's not just wet pipe. For anybody that has medical gases, I just have the slides in here for you in reference to the fact that there are new requirements that they have to be certified as well. So if you do have medical gas, a vent unit, where you have piped in medical gases, you need to make sure those individuals are certified, that are doing not just the certification for your system, but also anybody that's doing the maintenance. So we'll breeze through these slides, but I just want to make sure that you have them in there for anybody that has the medical gas system. This one is where I talked earlier. We talked more about the change from new to existing. So the key item to remember when you're working in an existing building is sections 4674 and 46122 of the 2012 edition of the Life Safety Code. Permits existing Life Safety Code features to be decreased only to those required for new buildings. And where that becomes important is, let's say you were a building that was constructed in 2009 and you were built under 2000 and new. So you're built under 2000 and new. That meant that the requirement was you had to have at least 8-foot wide corridors. But in this case, we're going to say you built 10-foot corridors because you wanted to make them a little bit wider than the minimum. So now, November 1, we're going to go do your survey, but we're going to survey you under 2012 existing, because that effective date of July 5th of 2016, you were built before that. So since you were built before that, you fall under 2012 Life Safety Code existing, which permits 4-foot corridors, because 2012 existing also has to, we have to survey buildings that could have been built in 1950, and maybe they had 4-foot corridors at that time, 5-foot corridors. So now the question is, can the facility build closets in the corridors or do something else to reduce the corridor width to 4 feet now that they're being surveyed under 2012 existing? And the answer is no. So you can only reduce the existing corridor width to 8 feet, which is the requirement for new construction. So you were 10 feet and you were built under new. You can go down to 8 feet, but you couldn't go less than 8 feet, even though existing does allow you to go all the way down to 4, because you can't decrease the level of safety in the building. So it's not the intent to decrease the level of safety within the building to which is lower than when it was built, with the exception of if there's something in the new requirements that say we no longer need this requirement. So the CMS Emergency Preparedness Rule, I was talking to Abby a little bit about this previously in reference to CMS. Had put out some information saying that in January timeframe, so I'm going to say first quarter of 2017 instead of January, just to be a little safer. Somewhere in the first quarter of 2017, they're going to put out some appendix material to all the information that they put out in the preparedness rule. If anybody likes Big Bang Theory, you can go to, there's a neat YouTube clip that I like to show where Sheldon has some emergency preparedness drills as part of the roommate agreement. So that's on here as well. But that's, in case you need a laugh, that's a pretty good one. But the CMS requirement, 1638 all, so the final rule was posted on September 8, 2016. It's over 600 pages, so there's a lot of information in there. And what I did in the next couple of slides is I took the information out for long-term care facilities, and I just put that information from that 600 and some pages just into these slides. So there's nothing other than the information that was put in the in the Federal Register. So it's nothing added, no appendix text, no opinion or anything like that. It's just the text itself. And the big part of it is obviously you have to establish and maintain an emergency preparedness plan that's reviewed and updated annually. And you're going to see that review and update annually pretty much throughout, as it's going to be a common theme. The one thing I really wanted to point out is that it's got to be community-based risk assessment. You're going to see community-based through here quite a bit. So it's based on and includes a documented facility-based and community-based risk assessment utilizing an all-hazards approach, including missing residents. Hopefully we don't have missing residents, but they made sure that they put that in there. So it has to be facility-based, so your fire alarm policy is typically more facility-based. This is a fire in my facility, this is what happens. But community-based, they want you to find out where you're at in the community with the emergency preparedness plan. So that's really reaching out to the emergency preparedness from maybe the county or your local municipality, your city, and saying, as XYZ nursing home, where do I fit in the community-based emergency plan, and what is expected of me? And I do have some contact information. I don't have it in the slide here, but if anybody wants that, my email contact is at the end, or I can provide that to Abby, where our Bureau of Health Preparedness has volunteered to help people get trained and educated, help them with their plans, get them kind of pointed in the right direction, because they do a lot of this preparedness work. So at the Department of Health, we do have our own group that does emergency preparedness, and they're more than willing to help out any facility that reaches out to them and says, hey, can you help me with my plan? What do I need? And they can do that for you. And kind of guide you in the right direction. So not only is it community-based, but it's going to talk a lot about cooperation, collaboration with your local, regional, state, federal emergency preparedness officials. And later on, we're going to talk about communication. So it's a lot of community-based, a lot of collaboration. They don't want you just being, this is a plan just for myself. They want the plan to be really well-rounded plan. So now you have the plan. Once you have the plan, you have to develop and implement policies and procedures based on the plan. And believe it or not, you have to review and update them at least annually. And you'll hear me say that quite a bit. They want everything updated and reviewed annually. So here's where it starts getting a little bit more, like I was saying before, I'm going to provide the information hopefully in the first quarter of 2017. CMS provides a lot more information on what this means. But we're going to point out provision of subsistence needs for staff and residents, whether they evacuate or shelter in place, to include food, water, medical, and pharmaceutical supplies, alternate sources of energy to maintain temperatures, to protect resident health and safety, and for the safe and sanitary storage of provisions. Emergency lighting, that was a little bit easier. We should already have that in place. Fire detection, we should have in place. Extinguishing in place. Alarm systems in place. But maybe sewage and waste disposal, that's something we have to look at. So right here, what it's saying, and we really have to, a lot of people are asking me, well, how long do I have to have food, water, and pharmaceutical supplies? How long do I have to maintain the temperatures? This is really going to be something the facility has to work out with their plan. If you say that I'm going to shelter in place no matter what the emergency is for 7 days, then pretty much by your plan, you're saying that you need 7 days of food, water, in my opinion anyway, until we get the CMS guidance, that you're going to need 7 days of these provisions because your plan says you're going to stay in your building for 7 days. It's also, we had 100-degree temperatures this year. A lot of people don't have their cooling system on emergency power. So what happens if you lose emergency power? Your plan has to be able to answer how long you can stay in your building with these different emergencies. That's why it's an all-hazards approach, and be flexible enough to say, okay, maybe we can stay for this long for this emergency, but if we have this type of emergency, we're not going to be able to stay, so we're going to have to evacuate, and here are our options for evacuation. And that's where we would have to spend a lot of time, on the plan, and it's really going to be the facility developing their plan and making sure that that's something that they can maintain. So we have to have safe evacuation. We have to have that, the ability to know where we can evacuate to and what's appropriate. I'm going to try to get through these slides a little bit quicker here at the end, so you'll have the information, and that way we get a chance to ask some questions. So you have to also be able to protect all your resident information, whether it's confidentiality, so all the HIPAA requirements. We need to make sure that we still are able to do so, even though we have the emergency. There's some information on here on the use of volunteers in an emergency situation. Are we going to use volunteers, or are we going to not use volunteers? That's all going to be part of the plan. And the arrangements in case you have to evacuate, or if you're going to receive residents from others. So all those have to be in the plan, and then they're going to go back. Now they're going to go from that policies and procedures to your communication plan, because they want you to be able to not just have your plan and be at your facility, but they want you to be able to communicate what's going on at your facility to the emergency preparedness people, whether it be the county, the state, the federal government, or to the Department of Health, CMS. And so your communication plan has to have a lot of information in it. So you have the names and contact information of your staff, the physicians, you see that in there, other long-term care facilities. And that's one of the reasons why you have to keep it updated. And maybe some of this information needs updated more often than annually if folks are always changing their phone numbers. But these are the communication requirements that you have to have. And you also have to have not just a primary, but an alternate means for communicating. So you need to make sure you have some type of reliable means that's an alternate to keep your communication plan going. And maybe your phones go down, so you need to have some type of backup plan for that. We're still more on the communication. They have a lot of slides on the communication, a lot of requirements on communication. So then once you have the communication plan, now we have to start testing and training our folks. So not only does it have to, you have to have your training and testing program, but you're going to have to update it and review it annually. And then we're going to have to do the initial training. So all new and existing staff, we have a new policy. It's our new emergency preparedness policy. So we have to train them first. And I might have forgotten to say this in the beginning, but we have till November of next year to get this all in place. But like, again, we don't want to wait till the end. We want to make sure we get this started, because you'll see that we do have to do some drills before to be compliant with that November date of 2017. So you want to do emergency preparedness training at least annually after the initial training. Maintain your documentation, and staff always have to demonstrate that they know what their role is. So testing, very important. We want to participate in a full-scale exercise that's community-based. So you'll see that again. So if you ask your community if they don't, to participate, and they say no, we don't want to, then you can do non-community-based, but they want you to do a community-based drill. And heaven forbid you do have an actual emergency, you can count that. All right, so if you have an actual emergency, we can say that counts as my full-scale exercise. But you also have to do a second exercise. If you had so much fun doing the first full-scale exercise, you can do another one. You don't have to. You can also do a tabletop. And then once you're done with your exercises and your testing, you need to analyze your response and say, we did this really well, we didn't do this so well. And then you want to revise and update that plan as needed. There does have some information on there and a lot of things that come back to the life safety code, where people are asking, it says emergency standby. Your generator location is supposed to be per the healthcare facilities code we talked about before. That's the NFPA 99, which we're already looking at. So emergency power system, inspection, testing, and maintenance, your life safety code surveyors are already looking at that. But the one that's a little bit confusing is the on-site fuel source to power emergency generators and plan to keep emergency power systems operational during an emergency unless the facility evacuates. That goes back to what type of fuel source we have for our facility and how we plan, how long we plan on staying in the facility for a certain emergency. Because if we plan on staying and we have no power, then what this is saying is you need to make sure you have enough fuel to stay for that time frame. So that was the emergency preparedness. I we'll go over this slide and a little bit of the carbon monoxide, and then we'll open up for questions. But they did put for the federal rule change for long-term care that recently came out, they did add one thing on physical environment that I wanted to point out. It says for facilities that receive approval of construction or reconstruction plans by state or local authorities or newly certified after November 28, 2016, so it's in effect now, bedrooms must accommodate no more than 2 residents, and each resident room must have its own bathroom equipped with at least a commode and a sink. So if you're planning on some construction, you know, it's one of those things where depending on what you're doing, if you're renovating the activities room or the dining room, you're not really touching the bedrooms or the resident rooms, then you know this might not apply to you. But if you're going to be doing renovations to the entire wing, and we're you know, changing some wall locations, and we're getting more than just putting up new wallpaper or paint, then we're going to be looking at having to meet the requirements for the rooms not accommodating more than 2 residents, and we're going to also have to make sure that you know, each resident room has its own bathroom with that toilet and sink. So it's very important. Anybody that had their plans approved prior to this date, you can keep building and not have to, you know, concern yourself with meeting these requirements. Is for anybody that receives approval of plans November 28th. After November 28th is where this applies. So this is important to remember for anybody that's looking to do some renovations or any new construction. House Bill 264, carbon monoxide alarms. Real quick, it had a 90-day effective date, so this is already in effect. So you should already be in compliance at this time. But if anybody has any questions, you feel free to let me know. I'll probably steer you to your local field office to talk about where to put the carbon monoxide detectors. But the big thing to remember is you're supposed to have carbon monoxide alarms at any fossil fuel burning devices or appliances. And then depending on exactly how that's installed, you might have to put some extra ones in depending on, let's say you have a hot water heater that's down in the laundry room, but if that alarm goes off where you have it installed, and there's no one's going to know that the alarm's going off because the laundry room is on the other side of the building from the nurse station, then we might have to add some extra carbon monoxide alarms. But this is something that I put all the slides in here, and we'll just kind of flip through them. So they have the information available. It's straight from the House bill. But if you do have any questions, let me know. One thing to point out is you do have to have some type of policy in place in the event that the alarm sounds, but they do not require that you have to do any drills. So it's important to know that, you know, we have to install them. We do have to have the policies and procedures in place. Everybody needs to know what happens when the alarms do go off, but you don't actually have to do extra drills unless you would like to do some drills to demonstrate that your staff is knowledgeable on what to do with carbon monoxide. If you do install them as part of a detection system, as part of your fire alarm system, your fire alarm company comes in and says, you know what, we can take this alarm out and switch it out with one that's a dual fire, the dual smoke and carbon monoxide. We just need to make sure it complies with NFPA 72 and NFPA 720. And then we just need to make sure that if we're doing extensive work, and if you have any questions about you know, what the extent of the work is, that we contact our plan review department here at my office, 717-787-1911, to see if you need to submit any plans to do the work. But this is something that everybody should already be in compliance with. That kind of came at us with a really quick enforcement date. At this time, I'll turn it back over to Abby to see if there's any questions, and then we'll answer some questions. And if, like I said, if we run out of time, you know, feel free to submit to Abby or myself, and we'll definitely make sure we get back to you. Thank you.
Great, thank you, Charlie. I don't have any questions that have come in yet, but we'll go over the last things. We'll provide in the follow-up email the contact information Charlie referenced for the Emergency Preparedness Division, and then certificates again will be emailed before the end of today, as well as a recording of today's presentation. Please feel free to share. We did have one question. to have a link to the final rule for the emergency preparedness rule provided. I will do that as well in the email. Another question, would the renovated hallway be the only resident rooms that would need to meet the new requirements?
Yeah, so that's a very good question. Yeah, that was correct. So the guidance I read, the information we have out there from CMS is, yes, say if you have an A, B, and a C wing and you renovate the A wing, that would be the wing that we'd be looking at where we'd have to meet the new requirements, and it wouldn't automatically go over to the B and C wing until such time that you decide to renovate those as well. Very good question. Okay,
and another one. Can we get some clarification on residents sharing a bathroom? A clarified follow-up question. Facilities that currently have 4 bedrooms and share a bathroom need to be changed. Do they need to be changed?
Okay, so I was going to go back. So the new requirement, as long as you're not doing any changes to rehab the building, if you're an existing building, you can maintain what you have now. It's once you start doing the renovations, and if you start doing more of the what they refer to as like a rehab or more of a major renovation, then you would have to comply with the 2 residents per room, and then they would just be the 1 bathroom for those 2 residents. But that is once you start doing a renovation project. If you say, at this time we have no plans, and for the next 10 years we have no plans, there's nothing out there to say you're going to have to comply with the new requirement for the number of residents in the room or the bathrooms.
Great, and it looks like that is the last of the questions. Thank you to everyone for participating in this, and thank you, Charlie, on behalf of the Department of Health for sharing your time and your expertise on this. It was very beneficial. Again, I'll send the email around with the link to the final rule, contact information for the Emergency Preparedness Division, the contact information Charlie referenced, as well as a recording of today's webinar and your certificate before the close of business today. Thank you, Charlie. Thank you to our participants, and this concludes today's webinar.
Thank you very much.